Health Explorer, produced by IntelliSphere LLC, is dedicated to impacting healthcare through education. We provide patients and caregivers with the latest medical information to help maintain and improve quality of life. Our staff of experts is committed to producing the highest quality educational content as the foundation for our integrated programs. We have a 3-tier mission with an objective to help you make informed healthcare decisions. Encourage people to be involved with their own healthcare. Educate people with the most cutting-edge and credible medical information. Empower people to take action and seek the advice of a healthcare professional. In the following comprehensive video documentary, we will provide viewers with a clear understanding of rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. Each program is presented by leading medical experts and advocacy groups like the National Pain Foundation, who lend expertise and provide recommendations on how to understand the disease state, use the information, and find additional resources for further support and information. This program and other valuable award-winning programs are housed online and easily accessible at www.healthexplorer.com.
Thank you for joining us today. During the course of the next half hour, Health Explorer is going to take you on an educational journey that will provide you with current information about rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. Whether you are personally suffering from these conditions or someone close to you is, we hope the information we provide not only answers your most critical questions, but also provides you with valuable insight when considering future treatment options.
To fully understand rheumatoid arthritis, it is first important to understand the anatomy of a joint. A joint is where two bones come together and articulate. The end of the bone is covered with a tough, slippery material called cartilage. Cartilage allows the bones to move smoothly and also acts as a shock absorber during impact. The entire joint is sealed within a structure called the joint capsule. The outside of this capsule is formed by ligaments, which attach one bone to another, and tendons, which connect muscle to bone. Inside of the joint capsule is a thin covering called the synovial membrane. This membrane secretes synovial fluid, which fills the entire capsule and provides lubrication during joint movement.
Rheumatoid arthritis, like any autoimmune disease, is a disease in which your body is working against itself. The immune system's job is to fight off foreign things, foreign infections, for example. So if you get a cut and it gets infected, your body recruits a lot of immune cells to that area. They fight off the bacteria, the cut heals, and the whole thing goes away. In rheumatoid arthritis, it's as if your body is fighting against something that's in the joint. You recruit all those immune and inflammatory cells to the joint. It creates a lot of inflammation, pain, and swelling, but it never shuts off and it never goes away, and that leads to the ongoing chronic process that's rheumatoid arthritis.
Rheumatoid arthritis is not limited to any particular area of the body. It can affect multiple joints and can cause damage to the cartilage, bones, tendons, and ligaments of the joints.
Rheumatoid arthritis, even though it affects the joints, it is what we call a systemic disease, meaning that it can affect other organs of the bodies. For example, people with rheumatoid arthritis have a symptom which involves dry eyes and dry mouth. They can also get cardiac involvement. They also can get lung and eye involvement. So it really is truly a systemic disease, not only affecting the joints.
It is estimated that over 2 million Americans suffer from rheumatoid arthritis. Onset of the disease usually begins between 30 and 40 years of age and affects approximately 3 times as many women as men. This painful disease affects people of every ethnicity and reaches to all corners of the globe.
Rheumatoid arthritis has a dramatic impact on patients' lives. Patients with rheumatoid arthritis not only have profound stiffness and swelling of the joints, but one of the dramatic symptoms that we see is patients have profound morning stiffness, meaning they have difficulty getting out of bed, doing their activities of daily living. We also know there's a significant amount of fatigue that involves with patients. So patients who have aggressive disease, they have to take frequent rest periods, frequent naps, and things along those lines. One of the other complications we've seen with the disease is that patients are also increased risk for depression. So even though it affects the joints, it has a dramatic impact on other activities and other aspects of the patient's lives.
While it's true that we don't know what causes rheumatoid arthritis, we have a sense of the process that leads to it. And if you look at the types of cells that are involved in the joints and in the bodies of people with rheumatoid arthritis, it's as if there is some trigger, like a bacteria or virus, that sets off the disease and brings in a sort of a cohesive group of inflammatory cells. We don't know what that trigger is. We've looked for years to try to find the virus that may set it off, and we don't know. But we do know that people with rheumatoid arthritis also share a lot of genetic makeup together, and so there's probably a genetic predisposition that you need to have something else on top of. As for why women get rheumatoid arthritis more than men, that's another question that we don't know the firm answer to, although the suspicion is that it's mostly hormonal. For example, women who have rheumatoid arthritis and who get pregnant will typically get better during their pregnancy and then flare after pregnancy. And the suspicion there is that it's changes in hormones that may affect the severity of the disease. And those same types of hormonal differences may affect the development of the disease in women versus men, although again, there may be genetic differences that separate women from men that may play a role as well.
Those who suffer from rheumatoid arthritis will often feel pain at the joint and have difficulty when moving. If a person exhibits these symptoms, it is important that they schedule a visit with their physician immediately. Rheumatoid arthritis that is left untreated may eventually damage nearby cartilage, bone, tendons, and ligaments. This can even lead to joint deformity and permanent disability, so it should not be taken lightly.
When a patient enters my office, one of the first things we do is do a detailed family history and a good medical exam. In addition to those, we'll also order some laboratory tests. There might be some x-rays or even MRI studies that we've done. So taking all those things together, we can identify not only the severity of the disease, but actually gauge our therapy based on those different events.
It is very important to diagnose rheumatoid arthritis and other forms of inflammatory arthritis early. The reason is, obviously, that a patient wants to feel better as soon as they can in order not to have pain, stiffness, and return to normal function. But importantly, we now know that by treating early, we have better outcomes in the long run. Less likelihood for joint destruction, greater functionality in the future, and even longer lifespan because we're reducing the chance for cardiovascular problems such as heart attack and stroke by reducing inflammation.
If during your diagnosis your physician notices any skin rashes on your body that are scaly, itchy, or dry, it may indicate a different type of arthritis known as psoriatic arthritis. This type of arthritis affects approximately 10% of people with the chronic skin disease psoriasis.
Psoriasis is a chronic skin disease that is characterized by scaling and inflammation. Scaling occurs since cells in the outer layer of the skin reproduce at a faster rate than normal and pile up on the skin surface.
The National Psoriasis Foundation did a telephone survey a couple of years ago and determined that there were approximately 1 million people in the United States who had been diagnosed with psoriatic arthritis. There are other studies that raise other numbers, but that's probably accurate as a ballpark figure. Psoriatic arthritis typically will start when people are in their 20s and 30s. The normal history of this is that you get psoriasis first, often in your teens or in your college years, and then the joint disease starts perhaps 5 or 10 years later. Men and women get psoriatic arthritis about equally. Unlike many of the other types of arthritis that we see, this is not a disease that's more common in women.
The symptoms of psoriatic arthritis can be quite varied. Pain and swelling in joints, sometimes a few joints, sometimes many. Unsightly skin problem, red, flaky skin problems that may be on the arms, hands, legs, trunk, or even the scalp line. Nail problems, back pain, and sometimes pain where tendons and ligaments insert into bone. Psoriatic arthritis can be misdiagnosed because it can present in so many ways. For example, there are other forms of arthritis that it can be mistaken for. The most common form of arthritis is called degenerative arthritis or osteoarthritis. That often occurs in the joints at the very ends of the finger And this can happen in psoriatic arthritis too. So that's one example. Another example could be rheumatoid arthritis, or something called ankylosing spondylitis that occurs in the spine. You can even have gout sometimes, which happens when you have crystalline arthritis, and that can be confused for psoriatic arthritis. A rheumatologist will have the understanding and experience to be able to sort this out and diagnose psoriatic arthritis.
The third type of arthritis we'll discuss in this program is ankylosing spondylitis. This type of arthritis primarily affects the joints of the spine and predominantly affects males between the ages of 17 and 35.
Ankylosing spondylitis is very difficult to diagnose. Oftentimes it occurs in a young male, for example, who may think that his back pain is simply related to his recent weekend snowboarding or doing some digging in the yard or something like that, and will often dismiss it. However, when it becomes more chronic and persistent and painful, that's when they may know that there's something really wrong.
Those suffering from ankylosing spondylitis will often experience chronic back pain and a stiffness of the spine. The pain has been described as dull, deep, and spread out, and it is usually made worse when a person is immobile for extended periods of time.
Ankylosing spondylitis presents with a real spectrum. For example, in some people it can be mild with occasional stiffness, but they can work and play normally. However, such individuals may have flares that can be quite severe and unpredictable. Other people may have chronic severe pain, problems with mobility because their spine has fused, and it can be severely disabling and one of the most painful conditions that humans can experience.
Rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis are all inflammatory types of arthritis. What that means is that they don't just affect the joints, they affect the whole body. These are systemic diseases. So they affect patients by interfering with their joint function, but they also feel systemically ill. So you can get fatigue, you have difficulty getting around, you have difficulty functioning, and over time these all can be destructive types of arthritis that lead you with damage to joints over time that then affects function later.
When a person suffers from rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis, there is a strong need to reduce the inflammation and thereby curb the pain associated with the condition. Historically, many patients have used nonsteroidal anti-inflammatory drugs like aspirin, ibuprofen, naproxen sodium, and others. While these drugs may provide temporary relief, prolonged use can cause side effects like stomach pain and bleeding. Analgesics like acetaminophen and tramadol are another common form of treatment that controls pain, but they do not affect inflammation. For more extreme pain, narcotics like codeine and propoxyphene may be introduced into treatment. However, long-term use is not recommended due to the risk of side effects and the risk of drug dependency.
One of the challenges as a rheumatologist is balancing the benefits and the risk of the medications that we use. For example, in patients to control their pain from the rheumatoid arthritis, we often rely on narcotic-based medications. On the short haul, those medications are actually very great medications, have very few side effects. But remember that rheumatoid arthritis is a chronic disease and many patients will be treated lifelong. Using those medications over many years, patients are at increased risk for developing dependency on the agents. They can also have potential for getting any liver or kidney side effects.
Since the 1950s, one of the most commonly prescribed drugs to relieve symptoms of these forms of arthritis is a drug called methotrexate. It is classified as a DMARD, or disease-modifying anti-rheumatic drug. While this drug has proven effective, research is still being conducted to explain exactly how and why it works.
Methotrexate we describe as a type of chemotherapy, and indeed it is used in certain types of cancers. So one way we think it works in patients with rheumatoid arthritis is that it attacks those angry, those inflamed cells that leads to the joint destruction. We also know that in addition to working very effectively on the joints, it can actually control other signs and symptoms of the disease.
Even though methotrexate is commonly used and can be very effective, it can also cause problems. For example, nausea, mouth sores, hair thinning, stomachache, diarrhea, and we strongly discourage anybody from taking it during pregnancy. We also have to check regular blood tests to make sure that it's not doing damage to the liver or causing a drop in the blood counts. Folic acid can be helpful for diminishing some of these side effects.
While these treatments have a solid history of effectively treating the symptoms associated with rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis, they do not halt the progression of the disease. In our next segment, we will look at a category of drugs called biologic response modifiers that do just that.
Are you a patient or physician who needs to stay abreast of the latest trends and technological advancements in medicine? If so, be sure to visit www.mdng.com, where you can join the nearly 200,000 physicians and specialists who count on MD Net Guide as one of their most valuable online resources.